Hello dear patients. Today we are going to review the case of unpleasant smell from feet, itch and peeling of feet. A 43-year-old man came to see us with such complaints as unpleasant smell from feet and peeling of feet. He used pumice for that, as well as different skin peeling products without any effect. We see some peeling taking place here. In first and second intertooth folds there was a small crack. By external view, a fungus has to be excluded here. Why? Because a common fungus is characterized by the thickened skin of soles, and during the lesion of palms it may be the same. As you can see, it is covered by small scales. In this patient, they gather up in the area of skin folds. They look as if they are poured with baking soda. In the first intertooth space, there's a little crack and it itches. The skin itself has a light pink color. It is slightly inflamed. It is important to take scrapings for fungus. This is a skin scraping for fungus, which is called microscopy, and the skin scraping, which is a culture test for fungus itself. What is a microscopy for fungus and what is a culture test for fungus? We have a separate video about it on our channel. So these two tests were done. This patient's nails were not affected. Culture test showed trichophyton rubrum. So that is a rubrophytia, which is a quite common lesion of skin of soles. It often progresses in latent form during a normal immunity. This disease often affects people in different showers, baths, etc., and quite often the people older than 30-40 years old are affected. That is, the people whose keratinization is slowed down. That means a discharge of scales of skin of feet soles. A therapy is indicated here. Here we prescribed an external medication in the form of nizoral cream for 3 weeks' time. Additionally, we prescribed lemizil tablets internally also for 2 weeks. Gradually this process resolved completely. It is very important to note that first of all, in the end of treatment, it is necessary to disinfect the socks. They can be disinfected by baking, by washing at high temperature. Also, the disinfection of footwear has to be done with formidrone preparation or other preparations containing formalin. Or the other method is to change the footwear, because often the repetitive infection is noted from own socks, from own footwear. Therefore, it is important to do such disinfection. Also, after having water procedures, it is recommended to do a full treatment of feet preventively with creams by type of nizoral. Or, for convenience, clotrimazole solution can be used, as clotrimazole solution is more convenient for doing such treatments. Therefore, during any lesions of skin of feet, it is necessary to exclude the common fungus, and if the analysis show positive results, it is necessary to do a full treatment of this mycosis. If it is necessary to diagnose and treat different skin lesions, you can consult the dermatologists of our medical center of paid dermatovenerologic dispensary in Moscow. We have experienced specialists who do diagnostic and treatment of such diseases. We are waiting for you in our clinic. Please subscribe to our channels on Instagram and YouTube. Thank you for your attention.